Hello, and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about constipation. So, constipation is often multifactorial. So, sometimes you got to work on your diet. Sometimes there's pelvic floor involvement. That's what I'm going to talk about. Some people need medications. They have like Crohn's disease or some gastrointestinal digestive issues. So, constipation can often be complex, but sometimes it can just be pelvic floor. But often I would say it's pelvic floor plus diet or pelvic floor plus something else. So there's two main things I want to talk about. So a lot of times patients that have chronic constipation, their muscles get confused and they forget how to poop. And if you've never been constipated, you've probably never thought about what happens when you poop. But what happens when you poop is your pelvic floor should open. This is what should happen when you poop or pee. Pelvic floor should relax and open for poop and pee to pass through, and then it goes back to being closed. Very simplistic explanation. And so if you're super healthy and poop is easy, it kind of just slides right out. You're lucky. Enjoy it because so many of my patients can't. But if you are a little constipated, you have to push, and the pushing really comes from your stomach, comes from up above, and your pelvic floor should still open and widen to and relax, let things pass through. But what happens in my patients with chronic constipation is because it's been so hard for so long that everything gets tight and everything tries to push things out. But what is actually happening is maybe they're pushing with their stomach, but they're also contracting the pelvic floor and they're just squeezing it off. So kind of like pushing against a closed door. And that just causes more stress, probably more anxiety, more discomfort, more difficulty pooping. So I'm going to show you this little chicken. I think it's a chicken. It's from Intimate Roast. They're a good company of pelvic floor products. But this is one of these pooping animals. So I use this visual with my patients. So the pushing should come from the stomach. We can squeeze the stomach and then it comes out. And then look from the bottom. So there's the pelvic floor at rest and it gets wider as it poops. So you can see that kind of there to there, it's getting wider. So that's what should happen. You're squeezing from above and the pelvic floor it's pushing out, it's widening. That's what should be happening. So it's a hard thing to practice and to get that muscle pattern because you're turning your stomach muscles on and your pelvic floor muscles off. And it's really hard to coordinate that because normally we want everything to go together. And the other tip that I really work on with people is I have them massage their stomach or their colon. Let me show you. My head's gonna get cut off, but we start from here and we go around. I'll link another video in the comments, but start at the right hip, light pressure, massaging in circles up to the ribs. We go across the bottom of the ribs, and then we go down the left side. That way we're tracing the colon, and we're helping to sort of what happens naturally is called peristalsis. It's inside the colon. There's muscle pumping action that pumps things through. Again, very simplistic explanation, but we're trying to stimulate that. So it's a light pressure massage. And I have my patients do those two things, and that helps a lot of their constipation. If it's a muscle issue, right? And so then again, we might need to address diet, we might need to address medical issues, but that's a really good place to start. So I'll link a short video that I did that shows that massage a little bit more detailed, but chronic constipation can be a pelvic floor issue. One other thing that I want to say about this is a lot of my patients with chronic constipation, so some of them have medical issue, they have a gluten intolerance, they have Crohn's disease, but a lot of them have a history of sexual abuse. And when I was a new pelvic floor therapist, I thought like, oh, sexual abuse is going to show up as pelvic pain or pain with sex. But very frequently it shows up as chronic constipation. So if this is you, I just want to say like, I'm so sorry this happened to you. My heart goes out to you, but you can get help with pelvic floor therapy, and hopefully whoever you see should be trauma informed. You know, they should take it slowly, ask for consent. But that's a lot of my patients, and they really, really can get better and do get better. And also, I highly, highly recommend if you've been through that, you see a mental health therapist and work on that aspect of it. But that's a really common thread that I see. And so there's help for you.